Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you so much for joining me, Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so happy to have as our guest Dr. Jaime Salas Rushford, who is an MD, medical doctor, with lots of other letters after his name, and we'll talk about those. He's a conventionally trained physician who also practices integrative medicine centered on performance athletics. He is the author of Fight, Colds, Flus, and Other Infections with AHCC. After completing his training at two of New York's preeminent hospitals, those are St. Vincent and Mount Sinai medical centers, Dr. Rushford went on to open the leading integrative wellness clinic in Puerto Rico, treating patients in many areas, including New York City, Florida, and Puerto Rico. He holds board certifications in anti-aging and regenerative medicine and is an expert on health and digestion and probiotics. So Dr. Salas Rushford has actually been working on the front lines with patients both in New York and Puerto Rico during the COVID-19 pandemic. And he helps people get safely back to work by writing opening protocols and establishing testing logistics. So thank you so much for joining us today, Dr. Salas Rushford.
Thank you for having me here.
So I want to go back in time and see, why did you become a physician in the first place?
Well, I actually went to medical school and law school, and I had to choose back in the day which one I wanted to keep. And medicine was a field that was fascinating because you can actually, I'm a mechanic by trade. It's something you can fine tune the body and learn.
Wait a minute, Dr. Jaime. You're a mechanic, you're an attorney, and you're a physician?
I had to choose between law school and medical school back in the day. When I studied, my university did not allow it to be in two graduate programs. So I got into both schools. All my families are attorneys. So I was forced to choose between whether to be a doctor or an attorney. And I just always found medicine very fascinating, the inner workings of how things work. And again, I'm a mechanic also by trade. And just learning the ins and outs, how you can fine tune something that is working good to make it better. And I always had that fascination if I could use medicine to improve health rather than cure disease or treat disease. And I had that angle since very early on. And I was fortunate enough to go on a path through athletics and performance and everything that I can just, take healthy people and see how can improve health in a way.
So you got interested first in regular medicine and then moved into looking at what might be called functional medicine.
Correct.
And to me, I think, especially with a younger person like yourself, to me, you're a younger person. Doesn't that make sense according to the latest evidence? Shouldn't all people who are going into be physicians be fully trained in such therapies that are shown to be actually much safer, in most situations excellently effective, and actually our best choice for primary intervention would be food, homeopathics, herbs, things that have a very low adverse effect incidence?
Well, yes and no. For food, it can be very adverse effects or very good effects. So for food, it's one of those things that can go either way. But again, you're right, totally correct. And I try to see my patients not as being sick, but as being out of shape or being, how can I improve what they have healthy or what they have good, and actually through that channel everything else to fall into place. You're totally correct. We should preserve health rather than treat disease. Obviously, there's diseases, there's cancers, there's different things that we cannot control, and we have to obviously battle those things. But 99% of the time, it has to be a side or an emphasis of preserving health and improving health.
So yes, and how we do that is not necessarily through the use of a pharmaceutical.
Correct.
Which of course are needed at times.
Yeah, pharmaceuticals play a very good role. Like I use pharmaceuticals to improve oxygenation on athletes to try to help them get an edge and recover better, try to avoid injury. But you're totally correct. It's an adjunct. It shouldn't be our main line of treatment at first. It should be something that we have there as equal as everybody else, as food, as supplements, and nutrition. So we as physicians, and at least in the United States, are trained that if you don't have anything wrong with you, there's nothing I can do as a physician, right? So like, for example, my nutrition class was maybe an hour, and I'm not going to say an hour, maybe a day and a half long. That's all I knew about nutrition.
That means that's all you were trained in conventional medical school.
Correct. And then once you go, well, like we say on the streets, private practice, you start looking at how important nutrition, how many people have questions about it, and how much misinformation or good information there is. And you become, an educator and a guide. So doctors per se, like with this whole COVID thing, we need to become educators and guide how we can help people improve their health, how we can teach people what everything is about, and how we can take fear out of living or getting sick or getting COVID, and just respecting our body and respecting the condition and respecting different decisions that we make that actually will have repercussions for years to come.
Well, that's an excellent, very, very large view, and it's wonderful that you have that information for your clients. You wrote an entire book, which of course is useful during the time of the pandemic and really any time, because people are constantly having various kinds of infections. And the book you wrote is called Fight Colds, Flus, and Other Infections with AHCC. But what is that?
Well, it's a mushroom extract. Basically, what it does is it's polysaccharides and glucans. In essence, for the listeners to know, the immune system is very complex. The immune system needs to be organized and has different stages, like an army. You have soldiers coming front, you have generals in the back planning strategy, you have people recording. All those things need to be interconnected. And this particular extract of mushrooms, AHCC, basically augments the response of the immune system, but also modulates it so it acts in an order. What you want to have when you fight a disease or when you attack a problem is to first identify, get a battle plan, and then act in a sequential order that makes sense. That's true for everything that you do in life, right? When you put a business on, when you study, when you get married, you have an idea of what things are going to be, and then you sit down and plan about it. So the immune system is the same exact way. You need to have an immune system that is healthy, and that's why you need nutrition. A lot of people think that, exercise is good. Yeah, exercise is great. But you need to have a balance of different things in life through exercise, aerobic activity, which is basically keeping your heart rate up, and also having good nutrition to actually feed those cells and feed the raw product that your body needs to build, T cells, dendritic cells. These are all part of the immune system. Those things don't come out of the blue. They just don't get created. They actually need to be made by the body, and those structures, like cells and so forth, need raw materials that we get through nutrition. So basically the book that I wrote was basically a guide to give another option to physicians, to clinicians, to healthcare providers, and to patients per se, to understand how the immune system works and how this particular compound can expose how the immune system works and how it can help, in this particular case, the flu. And now it kind of correlates into the COVID-19 era, right? We're living a different world, a different era, a different way of living, thinking, doing stuff. So it kind of falls into all that realm of educating people and giving options to them.
And I want to remind our listeners that you're listening to Herbally Yours right now on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and today my guest is medical doctor, Dr. Jaime Salas Rushford, and he has been wonderful of coming into New York and really helping right on the front lines with patients both in New York and Puerto Rico during the pandemic. Now, of course, Dr. Rushford, it's not the same flu and the pandemic infection of COVID-19, but they're certainly related. I mean, the flu can be caused by viruses as well. So you would think that some treatment options may be useful in both cases. So how would you describe the difference?
Well, you have to go to the basics, right? If it's a flu, if it's COVID, it's a viral illness. So you're going to have dehydration, most likely fever. There's certain symptoms that are very common among all the viral conditions, right? And what's important now that I'm trying to educate both my patients and the people that see me in different mediums is the importance of treating two things. Treating the symptoms very early on. Let's say you get fever today. Unfortunately, the fact is that a lot of people are still going to get COVID and they're going to develop symptoms. How can you educate those people to treat symptoms immediately? If you have fever, just take your antipyretic, Tylenol, Advil, whatever you have in hand that you usually take for fever, and hydrate well very early on. And that actually can save lives. Doesn't matter how complicated the condition is. Treat the basic things first very well. Like when you have a trauma, like I give that example. I have a multiple body trauma or gunshots or everything. The first thing you want to do is stabilize the patient. Treat very basic things, ABC, right? The famous ABC, CPR, first response. And that's what saves lives. And the other part is how to teach people if they get recovered from COVID, how can they work and actually make their immune system or make their body healthier? And just think about the decisions they made or made in the past and how can they be improved. Not necessarily that they were wrong decisions. Maybe they were incomplete or they can have some improvements into them.
Well, doctor, I heard, there's so much stuff going around on the internet, but I did hear a physician, his name is Dr. Richard Bartlett, and on a radio show that I listened to, he discussed that he personally has successfully used an old-fashioned drug that I'm sure you're familiar with. It's just an old-fashioned asthma drug called Pulmicort.
Yeah.
And you would probably know the drug itself. It might be budesonide, but Pulmicort is, the commercial name. Nebulized, which is an inhaled steroid, of course,
Correct.
And I've heard of other ones being used. And he said, especially with use in very early stages, he got, excellent relief for his clients, and that's a very inexpensive, widely available drug. What's your thoughts on that?
I think he's in the right direction. I actually personally use, because of availability in the different states that I work on or provide care for, I've used Pulmicort. I use Sopanex, which is levobuterol. It's an albuterol analog. Basically, doesn't affect heart rate. I also use Montelukast, which is singular that people know for little children and asthma. So it's true. What those medications basically give a relief to the bronchus and the bronchi and the lungs and make you improve oxygenation. What he's doing and what we're doing with this sort of drug is actually helping the body gain time. The body is the only thing that can kill or fight COVID is the body itself. Everything that we're doing, like these medications, like the AHCC, like the vitamin C, like vitamin D, like nutrition, is actually helping the body win some time for its own immune system to actually turn on adequately and fight the virus. So he's totally correct. I do agree with that line of medications. And again, it's very, you have a pulmonary condition mainly. And what you want to do is treat pulmonary symptoms. People, when you feel asphyxiated and with low oxygen, you feel horrible and you feel like the world is going to end. So there's a component also of anxiety that built into the COVID. And if you can provide relief on how you breathe and how your lungs are functioning, how you feel in that particular sense of symptoms, then you're going to have less anxiety. You're gonna cope better with the condition and hopefully make better decisions.
Well, absolutely. And certainly using a drug like that early on is a better, let's say, intervention, if possible, than using an invasive chest tube later on. So it seems like it would be a good choice to be standard of practice during this situation.
Yeah, what I learned in almost 3 months in the front lines in New York City, in Brooklyn, actually, I was in Coney Island Hospital, was the earlier you treat the symptoms with COVID, the better. Okay, so now what we need to teach people are two things: how to identify symptoms right away. Remember, like, fever, diarrhea, yes, but we have to also teach more to that. old people, the golden age, the people that are more aged in the 70s and 80s don't develop a fever. They actually, their temperature goes down. Oh, my grandparents, they're cold. They don't have a fever. No, old people cannot mount a fever. So those little things need to be addressed and teach to the public in general so they can identify those things and one, try to treat them with home remedies or the medications they have available that usually take, obviously with guidance and contact their doctor, or actually get help if they can actually be able to, transport themselves to a care facility that is nearby and adequate safely. So the earlier you can treat any symptoms with COVID, the better off you will be in fighting the disease.
So, doctor, might it not be prudent for people who even don't have asthma to perhaps have a nebulizer and something like Pulmicort or one of the other asthma medications you mentioned at home, perhaps prescribed preventatively by their physician?
What I told my colleagues is if they feel that they have high-risk patients and they can provide medications like this or the ones I mentioned, and they have no contraindications, to be proactive. As physicians, we need to also be proactive. We need to identify, like I'm a primary care physician. I know my patients for more than 10 years. I know who's going to be more susceptible to COVID or who might not be. Again, this is just an educated guess, right? Because we still are knowing more and more and more of the disease. But what we know now, I can actually make an educated assumption of who of my patients are going to be more susceptible. And I practically call them up and say, look, you should have this in your medicine cabinet.
Exactly.
And yes, I am proactive. But again, you have to teach him how to use it. You have to teach him how to actually not only prescribe the medication, but how does it work and when to use it and how would it interact with any other medications. So it goes far beyond just writing a script versus educating your patients in a way that they know what to do.
Well, which of these that you mentioned would be your first choice? And that would mean it probably, especially with a non-asthmatic person, you usually wouldn't have it, might be most useful. I think you also have to have a nebulizer. Is that true, to inhale it correctly, should it be for COVID?
So a lot of people have their own nebulizer machines, whether they're using themselves or their children have asthma or something.
That's
so
true. That's true. My grandchildren have that. Yes.
So they have it. And again, I do think that it's something that as physicians or as whoever's listening, our listeners need to say, okay, what conditions are more prone to COVID to be worse hit by COVID? COPD, for example, hypertension, congestive heart failure. Those people that have those conditions, kidney transplant or any sort of transplant, some on chemotherapy or cancers, those patients usually have a very tight relationship with their doctors. And what they need to do is proactively have a better communication and say, okay, doctor, the truth is COVID is going to affect everybody of us. Sooner or later, it's going to reach us or it's going to knock on our door. That's a reality. How can I protect myself in different ways? And this is when your herbal medicine, traditional medicine need to fuse. Like not only prescribe, the Pulmicort or the Sopanex, but also see what other supplements can actually benefit the patients and see, look, your vitamin D level is very low. Let's improve it. You need to have higher levels. And also not only work at the short end of the spectrum of something that they can do tomorrow if they get sick, but something that actually can work at the long end. Because reality is COVID is going to be the first of many, challenges we're going to face as humanity. And I don't think this is going to be an end. I think it's going to be a beginning of how we need to see our lives from now on and how we need to respect our bodies and treat not only ourselves, but our family members and make ourselves healthier.
Well, that's excellent information. And I want to remind our listeners that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. You can always listen to our show live or online at nccradio.org or on iHeartRadio. And you can also email us at whpc@ncc.edu. In addition, to find our guest, our wonderful guest, Dr. Salas Rushford, who's a medical doctor, we're referring to him by his first name here today, Dr. Jaime, you can find him and lots of great information at fitbodymd.me. That's fit, F-I-T, body, B-O-D-Y, M-D.me. ME. And also he has an Instagram account, Fit Body MD, with lots of wonderful pictures. And, you remind me a lot of my son, who's very, very involved in teaching people about how to take care of themselves. And he is an athletic coach himself. So a lot of what you're saying, really rings true, but not everybody, certainly the people that you're taking care of, are not all in, what you wish everybody would be, really wanting to maximize their fitness and wellness. By the time someone has COVID, you're talking about an acute situation that needs medical care.
Yeah, it's about trying to teach people not to fear the condition or the disease and respect it. How can they get it well informed and go to reputable sources of information like yourself? There are different sites that you can go. I try to write on my site and my Instagram also little pearls of just translating very complex medical jargon into basic things that people can comprehend. Like, for example, I'm not a CPA, so my numbers, my CPA knowledge is null. So I go to people that can actually take those very complicated terms and say, look, doctor, this is how numbers go. This is how you need to run this and that. So it's very important we as physicians try to translate to our patients in very simple terms. This is what you need to do in certain circumstances so people get it. If people get it, they're going to wear their mask. They're going to stay 6 feet apart. They're going to be conscious about other people. But, you cannot blame people for not doing things that they do not understand. And it's now this is a medical issue, right? This is not a political issue. This is a medical issue right now. How doctors can come forward, not as partisans, not as group members, but as individuals, and really teach people what the COVID means, what things mean in simple terms so they can get it and just follow basic precautions. So if and when they get it, they know what to do. And if and when they get it, they know how not to spread it in a way that it can get out of control, like we're seeing here, in different states. And believe me, it was a sight. When I was in New York, we were having the thousands of patients, and there are only so much you can do as a human being, as a doctor, to treat. I cannot treat 1,000 people an hour. I can treat a few of them, but not 1,000. And then it comes to the point of who gets saved, who can get treatment, who can get something. And we shouldn't be in that position. And who avoids that?
That is a sad space. I have worked, I'm a PhD RN, I have worked in a triage situation where you actually have to decide who gets care, because if someone's really, really bad, like you don't choose them because you feel like the resources might not help anyway, that's a terrible decision to make.
Correct. And those things can be avoided. We have all the resources in the world. And I'm not talking about money resources. I'm about talking of emotional resources, just human resources of people putting their part. In Puerto Rico, I went through one of the worst hurricanes the island has ever been. I lost my home. I saw things that I should never be seeing in this sort of way. And I saw total destruction. And then everybody kept their calm and pulled forward. And I think we have the ability as humanity to do it, but we need to understand and we need to know what's going on and how to work with it. If they don't teach us, we cannot expect people to know things are not taught or not guided. And this is why in different strata of society and professional fields and everything, we need to rely on each other to be able to take the word forward and say, this is what it means. This is what COVID means. This is how it gets affected. And this is how we can we make good decisions about it.
That's so true. Very, very wise to discuss that. Have you seen a difference in terms of working on the front lines? Because you were in New York. I know Coney Island Hospital because I lived right near there when I was a child. So that's kind of a rough neighborhood in certain ways as well. And the difference between, let's say, protocols in Puerto Rico or New York there in Coney Island, did you see a difference, or is everything pretty standardized?
Well, I was in New York just before the peak, when nobody really knew what was going on and how COVID worked. So we really were trying to, make educated guesses as to how to treat people. Intubate, not intubate, provide respiratory support, give medication. So we're in that dark zone of like not knowing and hoping that what we did we make better, not worse. And I think that quickly through New York, seeing so many patients, really provided a guide to what we as physicians should be able to provide early on to those patients to make them healthier or actually help them with their condition. And yes, it more got standardized and it kind of spread. In Puerto Rico, it was a delay being an island in a sense that not all the information came as quickly as it spread through the US. But again, New York had a lot of volunteers from many states, and they actually flew back home when everything, calmed down, and they were able to take that knowledge to different states. And I think that also helped because, yes, we're seeing a lot of infections, but we're not seeing that many deaths as we saw in New York City. And I think that's part of it. And again, one death is one too many, right? But if we have less, we're hoping to have less and less and less every day.
Yes, I do think it looks like we're moving in a better direction in terms of increased knowledge in the medical community and sort of less aggressive use of, intubation and breathing tubes, which perhaps is moving things in the right direction, and also earlier interventions. All those things, I think, are moving that death number in the right direction, although certainly the infection number, like you said, is still vastly spreading.
Yeah, it's inevitable that COVID is going to affect everybody at one point in time. And my personal opinion is that at one point in time, everybody's going to get some version of COVID because, we're social people. We need to go out. It wasn't contained at first, so it's going to spread to a point that, people are going to get it, and that's how COVID is going to end in a way once people get it. But the thing is, that shouldn't be an excuse for people to be negligent and just spread it out. So some people can get very, very sick and die from it. So we also need to be cautious, but also we need to be, knowledgeable to know if we get it, how we can treat ourselves quicker so we don't spread it to vulnerable populations that can actually be very negatively affected.
And also, like your life's work and mine, best advice is pay attention to your health on a daily level in terms of what you eat, what you think, how much you exercise. And that's something people can find out more about by going to your website, fitbodymd.me. Because certainly those people that don't have those complications and obesity and heart disease do better with this virus and in life in general.
Correct. And just listen to your body. The best doctor, I had a doctor who said, and my dad always said it, the best doctor is the patient himself. He knows if he didn't wake up the right way that day or something is odd in his body, but it's up to us as physician to help him, guide him through the process of interpreting what doesn't feel right. So,
okay.
If you don't feel right, just get help and let us guide you through the process of finding out what's wrong.
Well, thank you, Dr. Jaime, and thank you for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information about today's show, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, hoping that you stay healthy.